Welcome my friends to my channel. I'm Bob Schrupp, physical therapist. Today we're going to talk about the ways that you can possibly treat a herniated disc within the confines of your own home, which is pretty cool. This is the way I would probably start most of my patients if I've discovered that they were diagnosed with a herniated disc or even a bulging disc. And I'm going to show you at the end of the video why we're doing what we're doing now, but I want to jump into the exercises pretty darn quick here. First off though, I want to show you this diagram. A lot of people, when they first have pain, or when they develop pain from a herniated disc, it's going to go from their back, and this is the red markings here, and sometimes they go all the way into their foot. The purpose of these exercises is to help take away the pain, usually what we call distally first. That means the farthest away from the back. So what we'd like to see when you're doing these exercises is that some of this pain actually maybe goes away. Maybe the pain in the foot goes away first, or in the calf. This pain might actually even get a little worse, but this pain has gone away. Ideally what we'd like to see is that the pain goes completely out of the leg and maybe completely into the back, where eventually it'll go away. But the last thing we want to see is that if you're just having pain in the back and then you start having pain in the leg from doing this exercise, if the pain spreads out more, you should stop doing these exercises. They are absolutely not the right thing for you to do, and you're going to need the skill set of a therapist, or maybe you're going to eventually need surgery. So let's start off with the exercises that you're going to begin with. You're going to need a flat surface, hard surface. You can try this on your bed if you have a fairly firm mattress, otherwise you're going to have to do it on the floor. But the first thing, all I want you to do is I want you to lay down flat on your stomach. And if this is too difficult to do, and even this starts bringing on more pain down the leg or more pain in the back, what I want you to do is actually start with a pillow underneath you. And you can put it along the lengthwise here, put it along, the pelvis and the upper torso here, and you're just going to lay on the pillow like this and see if this helps start to decrease the pain down the leg. And if it doesn't make anything worse, then I'd go ahead and keep trying this. You can even throw an ice pack on and lay here for 15 minutes if this feels alright. If this works out okay, and especially if you start to feel a decrease of pain in the leg and maybe the foot, what I then want you to try is to try to lay without the pillow. For some people, we actually have to put several pillows, by the way, for them to even lay on their stomach to start off with. And then eventually we take one pillow away and another pillow away. But the next step would be to actually lay on your stomach without the pillow, or the next progression from that would be to actually lay on your elbows for a little bit. Again, a couple minutes. Let's just try this for a couple minutes, see what it's doing to your back. I do sometimes have people shift their pelvis over to the left or to the right to see if that makes any difference in what the pain is doing. Eventually, the main goal that you're shooting for here is that we're trying to get the back bending back like this in the opposite direction. Most of the activities that you do throughout the day are bent forward like this, correct? As you get up in the morning, if you wash your hair in the sink, or if you bend over and grabbing garbage from underneath the sink, bending over to put your shoes on, bending over to get dressed, everything is bending forward, and that's what causes the herniated disc quite often, to be honest with you, is all that bending forward. So we're trying to bend in the opposite direction is what our goal is to be doing. So once you've made through some of these other steps, maybe it won't even be the first day when you get to this point, it might be a couple days. What you're going to want to do, we're getting rid of the pillow now, is you're actually going to put your hands flat underneath your shoulders, and you're going to try pressing up like this. This whole time you're keeping your pelvis, which is right here about the belt level here, you're trying to keep that on the bed. What I don't want to see is that when you start lifting up like this, is that your pelvis actually comes up too. And that's usually what I do see on people, because their backs are usually fairly stiff going into this direction. The more bend we can get, the better off. Again though, the guidelines are, throughout the entire process here, is that the pain is getting better. It's not spreading out as much. It's becoming more narrow. You'll know if it feels right. People that this works for, they'll go, oh, this is what I've been looking for. This feels really good. And so what you're going to try to do is you're going to try to do 5 to 10 of these press-ups. Go up as high as you can. And what I want you to see is you pressure on, pressure off. That's all the longer you have to keep it up here. Pressure on, pressure off. Pressure on, pressure off. Eventually I'd like to see you do 10. I'd like to see you push it way up like this direction, keeping the pelvis down. Again, if you're up like this, that's not going to help. My partner, Brad, often tells people that if you can imagine that a belt is holding down your pelvis to the bed. That's what you want to imagine. So these are really the key component of the treatment, is that you're trying to get your back bending in the opposite direction, and I'll be showing you with a model of why we're trying to do that. We're trying to actually get the herniation back in. If you are able to do these, you're able to do, let's say, a good 10 of these. I'd like to see that you could do these 5 times a day. You could actually do it every hour even, if you're able to tolerate it. And that often sends you on your way to a recovery. You may get a little sore up in the upper back and shoulders because many of you aren't used to doing press-ups like this. The other thing is, you can, when you first start these, if it's too hard to do it with the hands underneath the shoulder, you can put them out here a little, and you're not pressing up as far then. So you can put your hands, quite a bit in front of you. If that becomes too easy later on, you can actually put your hands way down here, and now you can really press up and really get some extension in the back. Eventually, and this usually comes much later for people, I'm going to adjust the camera a little bit. Eventually what you can try is you can actually try standing up like this, and you can put your hands behind your back. I got up my hands around my belt level, and you can bend back like this. I'll go down a little bit further. You can see that. I got my hands behind my back, round belt level, and I'm pressing back. And what's nice about this one is this is something you can do at work, or let's say you've been riding in a vehicle, which is often very difficult for people who have herniated discs. It'll actually you're bending the back without having to lay on a floor. So you get out of the vehicle, you can do a couple of these. If you're about to do a lift, you can do a couple of these as a preventative thing. And again, you can do 5 to 10 of these. Pressure on, pressure off, pressure on, pressure off. Sometimes people even take a towel, if they have trouble doing these, and put it around their back like this, and then press back. And I'm going to adjust down a little bit here. You're not going to see my face as much, but it's probably good for you, right? Anyway, I got a towel here, and I'm pressing back like this. There, my back just cracked actually, and you can even move it up and down a little bit and get different levels. It's a great exercise to do versus using the hands. Okay, I'm now going to show you why we're doing these in the first place. Okay, what I have here is a representation of the spine. Basically, I have 2 vertebrae. These are actually coffee cups, believe it or not, vertebrae coffee cups. But normally the way your spine works, and this is the lower back, we're going to be talking about the lower lumbar vertebrae. You have 5 of these, but we're just going to look at 2 of them. And so you normally have a bone, and in between it you actually have the disc. And this is what herniates when you say a herniated disc. Now the disc normally fits between the 2 bones, and it provides you with some height, some shock absorption, and it also helps you, glide forward. The bones glide forward like this. Now normally in a healthy disc, if I'm bending forward, which is what I talked about earlier, how we spend a lot of our day bending forward, bending forward, bending forward. In a healthy disc, there's no problem with that. But eventually what happens is that the back of the disc starts to weaken, and eventually you keep bending forward, all of a sudden you get this huge bulge or herniation. Now I don't know that you can see this very well, so I'm actually going to come up to the camera. And again, watch the huge herniation there. Now the problem with that, when that herniation occurs from again, bending forward is how it occurs, is that behind there, usually the herniation occurs a little bit off to the side. There's one of the nerves that are going down to your leg, and that's where you can get that sciatic nerve pain, or sciatica as you've heard it called. So that bulge or that herniation will push right onto the nerve and send pain down your leg. So when we're doing the exercises, bending forward causes the bulge to come out. By bending back, we're trying to help push that herniation back in. Very simple concept, and it seems to work in many cases. It doesn't work for everyone. Sometimes the herniation actually gets kind of pinched and stays where it's at. But it's definitely something that you maybe want to try before you head into surgery. Or there's also, of course, the possibility of trying some traction to help pull that herniation in. Anyway, good luck to you. Please subscribe if you're trying to stay healthy and fit and pain-free. Thanks.